Canine Transmissible Venereal Tumor. Tumor, a mass of tissue made up of abnormal cells, often associated with neoplasia. Venereal, from the Latin word venus or veneer, referring to love or sexual acts. And transmissible, which is self-explanatory. It can be spread. It's essentially an STI, but cancer. It is one of 4 known transmissible cancers. The others, which we will not delve too deeply into, but maybe making a few comparisons here and there, are devil facial tumor disease in Tasmanian devils, Syrian hamster sarcoma in lab hamsters, and leukemia-like cancer in soft-shelled clams. Not all of these are sexually transmitted though, just to be clear. So, back to CTVT. Origin/history. Cancers don't usually spread from one organism to another because they're very specifically adapted to thriving in their one host. They are cells of that one host. They may acquire mutations that allow them to metastasize to other parts of the body, but it's still the same host. It is believed that CTVT's origin in an inbred population of dogs some 11,000 years ago allowed it to jump hosts. Because the dogs aren't very genetically different. So the cancer thinks it's kinda still the same dog. This is also the case for devil facial tumor disease in Tasmanian devils, having arisen from an island population. Mode of transmission. The allograft theory. An allograft is a tissue or organ transplanted from one host to another host of the same species, as opposed to a xenograft or autograft. CTVT cells are still very much dog in species. Just the really ancient founder dog passed around as a cancer for thousands of years. Most grafts get rejected because they present very different MHC1 molecules to that of the recipient. CTVT cells don't present them at all, so they don't suffer the wrath of cytotoxic T cells. Normally, natural killer cells would be alerted to this missing self. But for reasons unknown to research right now, this doesn't happen. Having thousands of years to select for traits that contribute to CTVT survival probably helped too. Characteristics that contribute to tumor transmissibility. 1. CTVT is externally located and very easily accessible to other dogs. Often found on the genitals and occasionally mouth and nose, through licking and sniffing said genitals. 2. The tumor is easily friable and bleeds a lot. Therefore, tumor cells detach quite easily. And 3. The mating behavior of dogs allows for prolonged contact in the coital lock. Friction during coitus results in injury to the genital mucosa that may increase the chances of entry for the tumor cells. Not a characteristic of the tumor, but more on the behavior of dogs, but still, it's here. It's taken into account. Cool. Next. Diagnosis. Clinical signs vary depending on where the tumor is located. Phimosis or paraphimosis can occur when the tumor grows on the penis. The perineal region may appear deformed in females. And there's a lot of bleeding, which may be mistaken for hematuria or epistaxis, or even estrus in females. It also attracts males. Evolutionary thing. Definitive diagnosis is by microscopic examination of exfoliated cells, collected via impression smears or fine needle aspiration. The cells exfoliate very easily, part of their evolutionary strategy. They look like this under a microscope. They are round cells with a lot of vacuoles in the cytoplasm. You can also find a number of mitotic figures in the nucleus. Treatment. Chemotherapy with vincristine sulfate is the treatment of choice. The way chemotherapy works is that the drug is selectively toxic towards cells with certain characteristics. Neoplastic cells often like to divide a lot. Vincristine targets cells in the M phase of the cell cycle. The M phase is when mitosis happens. Vincristine binds to tubulin, a part of the microtubule. When this happens, the mitotic spindle apparatus doesn't form. and the separation of chromatids during metaphase doesn't happen. So mitosis doesn't happen. This is why vincristine, as an anti-neoplastic drug, is classified as a mitotic inhibitor. But since normal cells are often very, very similar to the cancer cells we are targeting, side effects are aplenty. For vincristine, they are myelosuppression resulting in leukopenia, gastrointestinal issues, neurological toxicity, and issues with spermatogenesis. It's important to watch out for these side effects during treatment. Vincristine is administered intravenously every week until complete remission. Physical examination and a complete blood count is done before each administration. If something is amiss, like if the white blood cell count is too low, the dose may be reduced. Local tissue necrosis can occur if the drug happens to be extravasated during IV administration. Clinicians have to make sure that the drug is injected in the vein. Injecting through an attached IV line is often done. Prognosis is pretty good. Progress can be seen visually as the tumor shrinks in size during the course of the treatment. And total remission usually occurs after 6 gives of vincristine. To summarize, Canine Transmissible Venereal Tumor is one of 4 known transmissible cancers. It is hypothesized to have arisen some 11,000 years ago in a population of inbred dogs. The allograft theory explains how it jumps from one host to another. Clinical signs vary depending on where the tumor is located. Definitive diagnosis is by microscopic examination and finding round cells with vacuolated cytoplasm. Treatment is with vincristine. Prognosis is often good. That's it. Side note, I don't know where to fit this in the video, but it's cool. We generally view cancer as a bad thing and want to remove it from our patients. But this video gives a different view and it's very cool. Pretty cool to think about. Anyway, the end, for real, this time.